see. There we go. My name is Mark Hobgood, as Molly said, and I have with me today as well in the room Hal Patton. Hal is our CEO. I've known Hal for many years, and it's always been a pleasure to work with Hal. He and I were talking just the other day, but I think we determined that between the two of us, we have over 60 years in the industry and have experience from many viewpoints. Unfortunately, I think we've either worked in or worked with every type of provider out there, and over the years, from the urgent care and family medicine clinics to physician practices, outpatient clinics, I guess, acute care hospitals, and then of course in the managed care networks and Medicaid and Medicare networks. So we've even worked with third-party administrators. So I think between us, we've really covered all types of providers and really the payers that really affect the credentialing and contracting aspect of your practice. And so for the next few minutes, we appreciate your time. Wowza Management Services. I would also like to thank Dr. Tim Reynolds and, of course, the Medical Practice Success for inviting us to share some of the tools that Wowza uses every day to create a Wowza experience for our clients. The purpose of the webinar is to really briefly explain credentialing and contracting and how those two support billing. The process of credentialing and contracting, and then, of course, how to track and store the documentations. At the end of the webinar, I really encourage you to kind of reflect and ask, what are your policies and procedures? Do you fully understand the process, and do you have the resources to keep your contracts providers compliant for credentialing? You know, if the answer is maybe or you don't know, then I really encourage you to attend the Medical Practice Billing Summit in Salt Lake City on October 23rd and 24th. So let's get started. This may seem like a really odd question, but you have any idea what credentialing and contracting may have in common with the president? Well, they both can turn your hair gray. They're both without proper preparation and a plan of action. It can be very stressful. I'm always amazed when I looked at the presidents as their hair grays over their term in office, and I'm going to go out on a limb here, Hal, and say that if I was a betting man and Trump was elected, I really don't think his hair is going to change much by the end of the term. I don't think he's going to let that get gray, but make it a little thinner there. But that's just a thought. So let's move on. Really, if you think about the process of credentialing providers and facilities, negotiating contracts, and billing for services, it is a complex process. But all of these three areas must work together to avoid unnecessary billing delays and write-offs. We know from experience that the more a biller understands how credentialing and contracting are related to the billing process, the more engaged that biller is in the process. I'm a visual learner, so when I think about the process, I think it's similar to building or constructing a pavilion. It has a foundation which provides support for the columns which the roof rests on. The foundation provides that structural support. If you look at your medical practice, your providers are the foundation that builds the practice, and it is the credentialing process that allows your providers to participate in health plans and the ability to receive reimbursement for the services they provide. Building the foundation is critical. You can have the most qualified providers in the nation, but unless those providers are credentialed properly and remain compliant, then you will not be reimbursed for the services they provide at the maximum levels available. Payers use the credentialing process to ensure that their providers are qualified to meet the needs of their members, and is a very important process and critical to billing. Contracting acts like the columns in my thought for the pavilion. They provide the support to credential the providers to receive the reimbursement for those services. And the contract provides legal documentation on reimbursement, claim submission, appeals, and state mandated payments for a few things. And then the last process in that is actually adding the roof. So once your credentialing and contracting are complete, then you're ready to bill. And it's important that all those work together so that you will have a pavilion, or I say a practice really, that is strong, supported, and that allows your billing to roll very smoothly and to be paid in a very seamless manner. So it's important that all those processes go together. Well, let's talk about credentialing. I don't know if you've ever been in the process of trying to get a provider credential, but I kind of feel like this lady does here. It can contribute to hair loss, and then, you know, there's so many things that you have to put together that I became a sticky note junkie, trying to track everything and then following up with various verifications. I mean, it's a process out there, but with the process, you can ease that pain. Planning is essential, starting with the creation of a core file to store the documentation for each provider. All your documents is stored there, the license, certificate, everything needs to be in this one file. So the first step for creating the core file is also creating the checklist so you know what documents you have in-house and those that are outstanding. Use a checklist as a quick reference of how the process is moving forward, how you're close to you to be able to begin that submission of an application. Also, it's very important that you do background queries, the OIG and SAM. We like to do it at the start of the process. It allows us to catch any background issues that the provider may not have shared with you, and it will eliminate, if you get to a point that you may not want to employ this provider, then you don't have to start the collection of these documents. WALS also sends an onboarding packet to our providers. It explains why we're asking for the documentation. It's been our experience that an informed provider of why we're requesting the documents and when those documents are due engages the provider and encourages the information to receive back in a timely manner. We talk about the amount of documents. You can see here, this is just a partial list, but I think it demonstrates why creating a credentialing file, a core file, and while the whole process can be like pulling your hair out at times, because collection of this document is one of the most time-consuming parts of the process. And generally, do not submit an application without all this information, or without the application being complete with all documentation. It only delays the process, and when the credentialing is delayed, so is your revenue stream. You manage the documents as say in the core file. This is just a sample of how you may want to set it up. These are again created for each provider, and then within the file or sub-files where you can actually store the documents. You can decide how to organize the files. These are just some examples. And it's also good practice. It's not listed here, but to create a file to keep all your expired documents, licensing in. And you never know when you may need that information to refer back to. I want to share with you a way that I got rid of my sticky notes here is by creating a checklist. This is just a simple list of what is required from your providers. When did you receive that information? And then what I like to do is highlight the areas. Actually, one of the people I work with, Leanne, she does this all the time, and it allows us to be able to go back very quickly and see exactly what is missing and what is necessary before we can start the process. Then once you have started collecting the information, another great reference tool is our licensing mix. All these I'm showing you are just very simple made tables within a spreadsheet. So anyone can take this and use it to help your process. But these matrices allow you to find, especially this one, information very quickly, such as the MPI numbers, when your licensing are expiring, date of hire, date of birth, all the information you may need for an application is in one location. I think one of the most challenging aspects of this is not only the beginning of the credentialing process, the initial credentialing, but also keeping up with the provider to keep them compliant on an ongoing basis. And if you have a matrix that is up to date and you check it monthly, you should never let a license expire or certificate to expire. As you can tell, it's a complicated process, credentialing, without the planning and without the preparation, it becomes a nightmare. It can become a nightmare. Well, let's talk about the second part of the process. Is contracting. To let you know, there's different types of contracting entities that you'll work with. Of course, there are the health insurance companies we all know, such as WellPoint or Blue Cross or United Healthcare. But then there's also the creation of regional plans, basically because with the metallic plans or the Obama ACA plans, these smaller, there's more regional health plans being developed, and they have a smaller network, and the providers are designed to steer members maybe into the hospitals, into the practices that they have interest in. Provider networks can be national or regional, or even a locally owned provider network. And there's third-party administrators, also known as TPAs. I think it's important that you realize that TPAs are not insurance companies. They administrate the health plans of large employers who are self-funded. And then there are cases that you may be approached by a large employer in your area for a direct contract. There's different types of plans that are represented within each of these contracting entities. I think everyone is familiar with your commercial plans. These are the ones which employers have provided to employees for years. With the passage of the Accountable Care Act in 2010, we introduced the metallic plans. A good thing to remember when contracting to participate in a metallic plan, please pay attention to the reimbursement rate and how to verify eligibility. And the reimbursement rates can be different, basically more aggressive than your other managed care plans that are commercial plans. It's also important to ask about how to determine eligibility. The ACA plans have a 90-day grace period, which is required by law for a member to pay premiums. And if you happen to see and provide services to a member and they're in the grace period, after the 91st day, that provider or that payer, will come back and ask for a refund of those payments. There's a couple of small ones here: workers' compensation, auto liability. Many people are not really that much familiar with those types of contracts, but also they're at different levels, different reimbursements, usually lower than your commercial plans. You'll hear discount card programs. They're just exactly what that indicates, a discount for services from your bill charged. Most of the providers that we have worked with are electing not to participate just because they have their own self-pay programs, which are priced at a reduced rate from their regular charges. Hal and I were just talking today. Don't be afraid to walk away from a bad contract. They're just bad contracts for your business model. So walk away. But also remember to always attempt to negotiate. I don't know how many times we've heard you can't negotiate with ABC company. And if you know your market, the value and the service you provide is solid, well respected, the better position you are to negotiate. Many providers focus primarily on the reimbursement rates, and they are very important, but there are other important items in the contract. So remember, when they require you to do something, for example, what is the payer required to do in the same instance? What's good for one, is it good for the other? And who are you contracting with? We've been down the road together, Hal and I, think we're with the right person making a decision in a contract, and only to find we've hit a snag in the process, or someone has told us we could do something, only to come to find out we were talking to the wrong person, and they really couldn't give us that support or that language that we're requesting. We also encourage you to develop a key contact list, because there may be more than one person during this process that you're going to be dealing with. And to have those names, those numbers at your fingertips, just makes the process easier to manage. The meat of the contract is the language. There's key points of every contract that you should know. For example, how's your practice defined? Hal and I both have reviewed contracts for clients, and that contract was not the proper contract or reflection, I should say, of what type of service they provide. So always check the terms. When you may experience a great relationship for a few months with a particular payer, and then that relationship, turns the other way. And if you're locked into an initial 3-period term, for example, then you're not going to be able to get out of that contract for those until the end of that 3rd period. So it's important that you look at those terms, and you also need to know how to terminate, what the clause is to get out of that agreement after the initial term as well. Clean language, is very critical. We've also seen contracts where language did not follow state law. Many times it was just an oversight by the payer as they were working on a particular agreement for a provider in a different state. But make sure that that language is applicable to your practice as well as to state law. Understand the appeal, and collection of under and overpayments. And if you determine, for example, if you terminate a contract on October 1, how long can that payer come back to you seeking adjustments for services? If they can go back 2 years, that can come back and kind of haunt a practice if they're seeking a lot of money and you've terminated that contract for 2 years prior. Reimbursement, do you know what the methodology is or was used to calculate the rates? And how can you compare those proposed reimbursement rates to a benchmark? It's very common for a payer to list reimbursement in an amendment only stating reimbursement is 140% of ABC Company's 1995 fee schedule. And so that gives you absolutely no understanding of how it was calculated, what it was based on. So it's really important to understand methodology. And as well as understanding how they can notify you of changes in the contract. And if they're going to make changes to the language and to an amendment, try to get that for both parties signed. Signatures are required. Many times in contracts it will just state that they're going to publish this in their monthly newsletter, and that just opens an opportunity for you to agree to do something that is not in the best interest of your practice. And again, the last thing that's down there, signatures, I can't express to you how important it is to have a contract with both signatures on it. And it's not fully executed until both parties have signed that agreement, so push to have a fully executed agreement at all times. Just like credentialing, it's important to develop a core file for each of your payers. This is a place, again, where you put all your agreements, correspondence, and amendments are stored. Anything that, also developing, sub-files for anything else that is related to your contracts. What we like to do with each one of our agreements is to make a table of contents. And that just is a listing of each article and section in that agreement with page numbers of where to find that information quickly. Many times we're asked by billing especially, of certain contractual terms within the contract, and this gives you a way to have a quick and easy reference to that. We also use a summary sheet, which is a little bit more complex than, of course, your table of contents, but it also then condenses down into 1 or 2 sentences such things as the term, the length of the contract, reimbursement rates, things of that nature. One of the things that we have found that many people forget to do is to always have your top codes ready for reference. You can get your top 25, 50. We like to work with the top 100, but you'll find that usually the top 25 to 50 codes covers the vast majority of what you're going to bill. But that's where you'll really understand what you're being reimbursed. What is this contract asking you for reimbursement? Here's a quick example of a contracting matrix, which is how we put all of our payers onto one contract sheet, or one, spreadsheet. And if you'll notice here, there's on the left side there just basic information of the effective dates, renewal, things of that nature. And down below that, we start and we use Medicare as our base in our contracts for comparison. And then we will see how that Medicare at 100% for the locale of that provider location reflects to the contract. This is a great way to be able to look at your contracts and see how you're being reimbursed by from each one of your payers. An example here of the contact list for the payers. We like to also, you notice on the right-hand side there, we like to collect personal information about the contact so that when we're talking to them, it's more of a personal experience than it is just calling and asking them if they can help us with a problem. So we've just scraped the surface of what it takes to have a successful credentialing and contracting program, but we hope we're able to provide you at least with one item that you can take back and help your program. Again, thank you for your time and hope to see you in Salt Lake City.
Thank you so much, Mark. That was awesome information. And like you said, we are having a medical billing conference in Salt Lake City at the end of October. It's the 23rd and 24th. Of course, like you see the domain there, if you go to medicalbillingconference.com, you can check out more information there. And for attending the webinar, you can save 10% now. I believe each admission is only $50 or $599.97. So we've reduced pricing greatly from our previous events. So if you do want to join, or if you have any questions about anything that Mark said or that you've learned or anything about the summit, please email me. You can reach us at info@urgentcaresuccess.com. Again, that's info@urgentcaresuccess.com. And I'll also be issuing a replay of this webinar as a follow-up. So if you want, I'll of course, send that shortly either today or tomorrow. So you'll receive that as well. So thank you all again. And again, just reach out to us if you have any questions, and we hope to see you in Salt Lake.